But I'll continue with this particular, announcement and, document from the Ministry of Health, clearly and evidently showing that there is a problem.
Yes, so oral diseases are a big problem worldwide. So we have as of now, we have about half of the world suffering from oral diseases. That's 3.5 billion. Do we hear about it? In Kenya, we have 98% of adults having a gum problem. 50% of our children have dental caries. Yeah, and that's a huge percentage of our children having dental caries. Another problem that we have in Kenya is 41% of our children, that's almost 50%, have dental fluorosis. Dental fluorosis is when we may have seen it amongst our people. Yes. The teeth are mottled, they look brown, they look chalky. And why should any of our children suffer from this? It brings about so much of loss in confidence. They don't feel happy to smile. And why should anyone have to go through this at a time where we've made so many advances in health? Why should anyone have dental fluorosis, for example?
Yeah, and I like how passionate you're coming out in this subject. So I really want to know a bit of history in your dentistry. Please bring us up to speed. When did you start this? Now you're at the county level. But what has your journey been like? Because really we need that background so that we come closer to why then you passionately advocate for oral health.
So I always wanted to be a dentist since the age of 9. I had a dental cavity at around that age, and I actually used to follow it in the mirror, and I realized that it was getting worse over time. I mean, I was very young, and at that point in time I went to a dentist and I got my tooth pulled out, and that was what brought me into dentistry. Like, I was attracted to the field. I was very lucky to be able to follow my passion. I graduated as a dentist in 2011, and I came to Kenya to work in Kenyatta National Hospital, and then finally I went to Gatundu in Kiambu County. So I genuinely enjoyed doing restorative work, drilling, filling, seeing patients, but over time I came to realize that I wasn't able to reach to the masses. Like, the queues in Gatundu would just keep on increasing. I would be seeing like 40 patients a day, and I would be talking to each patient, telling them how to prevent their problems, but how would I reach to the bigger, to the general population? So that's what drove me to now go into advocacy, and I did a master's in public health.
And clearly there is need for this awareness even more. Thank you very much for choosing Health Inside Out on the Morning Drift. And I'm hoping you're all watching from back at home. Parents, your children could be going through something right now you have questions about. Here's an opportunity before you get to the longer queue. Watwa Kiambu County, I'm giving you an opportunity to use our comment section and ask as many questions as you possibly can, and Daktari will give you answers this minute. Of course, use the hashtag #TheMorningDrift. Now, we've looked at, the report from the Ministry of Health. You've also shared a bit of statistics. So I personally think there is a big problem. But now if we came back to your expertise from your perspective, what is the big problem?
Well, first off, the big problem is that we're not recognizing oral diseases as a problem. We define oral health as important for general health. So there's a problem in our definition in itself. We define dental caries as a disease that is caused by consumption of sugar, and basically we don't define oral diseases as a major problem. So we need to go into that first.
Before we get into it as a problem, allow me then now to again take us back to the definition of oral health. Or I don't know how you're going to put it, but then after that you can let us know now the problem with it.
Okay. Yes. So the definition of oral health is, first of all, it's important for general health, and there's a wider definition that says that oral health is basically the absence of disease. It's the ability for somebody to be able to eat, smile, talk, use the functions of the oral cavity in a healthy way, right? So that's not the exact definition, but that's a general definition, and we are looking at it as an absence of disease. So we need to be able to define oral disease in itself as a problem, and at the moment we don't have that. We just define it as, okay, it's important for general health, and that makes it sort of like very we don't have it as a very it's not out there.
It's like minor.
Minor, yes, it's minor. Yeah, oral health is important for general health.
Your mouth, your teeth.
Yes,
You need to see the dentist. That's how we carry it around.
Yeah, that's
here.
how we carry it out. So that's a problem to begin with. And then the statistics are there, but we don't have enough research carried out in the oral health arena. Very few of us dentists actually go into the research field. We don't have enough data to support it. We don't have, even for example, in Kenya, we have the health information system, but we don't have integrated data for oral diseases. So we're able to tell in a county how many people have HIV, how many people have diabetes, but we're not able to actually tell how many people came to the dental clinic and got a filling done, even as we speak, because the systems are not integrated, so we don't have that data. Yeah.
So there's a problem mainstreaming this particular, sector of health into the entire
general health system.
Health system. And even as we're talking, the permanent secretary of the Ministry of Health noted that an oral survey conducted in 2015 revealed that 1 in every 2 children aged 5 years suffers from tooth decay. Now, the findings also indicated that all adults interviewed had at least one current dental problem that required attention. Now, this is indeed a worrying situation in her own words. That is what she said in our country. One, that the 2 documents that she's referring to they were launching on that particular day helped them to fix. Now, my question is, help them to fix. The Ministry of Health is probably watching right now. You are representing the ministry at a county level as far as dentistry is concerned. They're talking about fixing the problem. You've mentioned that there is a problem.
Yes.
How are you fixing it?
So currently, how are we fixing it?
How are you fixing it?
Well, okay, of course, I would like to first say that it's a bold step, it's a good step that we now have the policy in place and we have a strategic plan. So there's hope, right, that we are working towards fixing it. But the investment in the oral health sector has been very negligible. We have very few dentists in the country, so I'll tell you the number. We only have about 800 dentists practicing for a population of 50 million.
Is this factual?
Yes. So that's the current register that we have. 800 dentists are currently practicing for a population of 50 million. So that is very few dentists, and unfortunately most of the dentists don't work in the public sector. They work in the private sector in urban areas. So you can imagine that the person in the Mashinani, in the rural areas, don't have access to quality oral health care. So yes, there's a lot of work that needs to be done in terms of the treatment of the problem, right? Yeah, we need to be able to treat the problem. So we need to have an investment in training of dentists, training of community oral health workers as well. That's another cadre that we have in Kenya that was meant to improve the community oral health. So we need to improve that, and we need to fix that gap that we have. Apart from that, most oral diseases are preventable. There's no way we can invest only in the curative side. We need to be able to also invest in prevention and health promotion, right? Something like dental fluorosis. What causes it? It's the high levels of fluoride in the water. Why is it that it's not possible for us to fix that?
Good question.
Why are we not doing anything to fix that? Why should any person have access to water that has such high fluoride levels that leads the parents spending so much money to make their children have a beautiful smile at the end of it? So that's another aspect we need to look at. So prevention of the problem. Dental caries, very preventable. What causes it? High intake of sugars, poor oral hygiene. What can the government do? We need to look at ways in which we prevent the high intake of sugars. Some countries have initiated sin taxes.
All right.
Yeah, so that means anything that has high level of sugar is more expensive. So it kind of discourages you from purchasing the soft drinks and beverages. Yes. What happens here? Let's just take it as a layman. When we go to restaurants, for example, a bottle of water costs more than a soft drink. What are we doing? We're nudging people to drink Coca-Cola rather than water. Why is water not easily available to drink? Similarly, in schools, in hospitals, I'm surprised that we still sell soft drinks. Yeah, so we need to have a move in that aspect to nudge people to make to take up healthy behaviors. So that's preventing the dental caries. We need to have, we need to have even more school health programs, community outreaches that educate the people on how to take care of their teeth, how to take care of their gums. And also, we have another big problem that's coming, that's on the rise, oral cancer.
There we go.
So oral cancer is not something that we should be, ignoring. It's one of the top 3 cancers, yeah.
And I like that you brought that up now that the public doesn't talk about it much. Perhaps we need to hear, because when we talk about oral health, the first thing they think of is, oh, my teeth. But I'm glad that you brought out the aspect of oral cancer. I know we are still continuing with this conversation, but touch more on the oral cancer aspect and how we can prevent it, because you're talking about prevention as a very important and vital thing right now.
So oral cancer is on the rise, and more so because we have the risk factors that now more people are using tobacco, alcohol. So because of all these intake of tobacco, smoking, so we have an increase in oral cancer. And the thing with oral cancer is it has to be detected early, right? So we don't have enough manpower in the field to deal with the detection. What can be done early is, an early detection of the cancer and early treatment. When it progresses is when it gets worse. So we really need to focus on prevention of the cancer by educating people to not take tobacco, not take alcohol, and also have an early detection. That means on the field, in the ground, those people who are working in the ground should be trained to detect cancers early. The same way we do cervical cancer screening, we need to be able to do oral cancer screening. Yeah.
That's quite interesting. You mentioned, having communities involved, schools and trainings. And allow me to go back to, the report by the Ministry of Health that said, rather, the Permanent Secretary assured that the ministry has put mechanisms, in place to fast-track implementation of the policy in order to grant Kenyans their constitutional right to health, and also to accelerate the attainment of universal health coverage. Now, she said that the policy will be implemented in consultation of all stakeholders, including yourself, both public and private, that are actively working towards, achieving the universal health care in Kenya to ensure that proper attention is given to oral health needs of Kenyans, especially vulnerable groups. Now, that's where I was coming at. Among other mechanisms that ought to be put in place, I'm looking at the county levels, for example. You've mentioned schools, very, very vital. You've mentioned communities. Which other mechanisms, even as we're creating awareness, who are the stakeholders even to start with? And what responsibilities are we looking at?
So the major stakeholders at the county level are the governors. Okay, because in Kenya, health has been devolved, and each county is taking health as a priority at the governor's will. It depends on the governor's interest. It depends on the governor's priorities. So the major stakeholder is the governor, and if we are able to get buy-in from them at that level, we are able to focus on health in general. So, for example, in Kiambu County, we have had a county dentist, which was the first in the country, because the governor at that time, when I was elected, had an interest towards oral health. Yeah. Now we have a new county dentist in Nakuru as well. That's the second county dentist in the country. So we can see that there's an interest and there is a move towards goodwill towards that. So we need to ensure that all the 47 counties have a county dentist, and that is part of the strategic plan as well. That there should be leadership at each county, so that now the county dentist can direct the curative side of oral health and the preventive side. When you have someone who is able to direct the oral healthcare sector, it's easier. So that's the first thing that we need to do. Have the governors on our side, have this chief officers of health, chief executive committee of health, CECs, to buy into the idea that oral health is important, and we need to have a county dentist the same way we have a county pharmacist. Right?
All right.
And once we have that, now we can work on implementing the strategic plan at county level. Apart from that, the people are our stakeholders. You need to realize that oral health is a problem, right? And we need to start demanding for these services at our level. By services, I don't only mean drilling, filling, cleaning. I mean also services that allow me to have access to safe water with safe fluoride levels. Right? To have access to see a dentist when I don't have a problem, right? It's not just when I have a toothache that I should go looking for a dentist miles away from where I am. Yeah, those kind of things.
And speaking of, access to healthcare, it's come out very strong right now. Look, there has been an issue of costs.
Yes. Yeah.
And the reason why people would rather ignore, you know, the pain on their tooth until it's now decaying or pretty much affecting the entire oral makeup is because can Kenyans afford what you're drumming support for? Fine, the dentist will be available, they will be trained. It can take some time to, you know, train a dentist. And most of them, like you mentioned, are practicing privately.
Yes.
Can Precious, you know, can Griffith, can Anki, or the common Jerry actually access this quality healthcare as far as oral health is concerned?
So that's a very good point you've raised. Unfortunately, oral health care is mostly out of pockets expenses. It's not covered in the essential package of oral health, and that's what we really need to push for. First of all, make it available,
yes,
right?
okay.
By making sure that we have the dentists and the oral health care available in the public sector, and also ensure that it's covered by the essential package of oral health. We need to be able to make it affordable. Now, worldwide, oral health care costs about 440 billion. Okay, that's about 4.6% of the expenditure. So worldwide, it's also a problem. Dentistry is expensive. In Kenya, you're looking at about spending at least a minimum of 10,000 shillings or even more, depending on where you go when you go for a dental visit. Who can afford that? Not everybody, right? Even insurance packages cover very limited amount. You can have a family of 5, and the insurance cover is only covering 10,000 shillings. So yes, affordability is a problem, and we really need to increase or have insurance cover to include oral health.
Yes.
The package expanded, because even some insurances don't cover something as important as cleaning. Yeah, that's they deem it as an unnecessary expense. Luxury, but it's not. If the statistics said 98% of Kenyans have a gum problem, why? We need to be able to access the dentist once a year to get our gums cleaned professionally.
Once a year.
At least once a year,
okay.
yes. So yes, affordability is an issue, and we really need to advocate for increasing access. Also, that will also indirectly increase affordability,
yes,
and improve the insurance package for oral
because
health.
I know for sure that has been a problem years and ending, and we're looking at a next government coming in. Perhaps then we see a different parliament, also have different sittings pushing for more of oral health discussions and debates, bills, etc. Now, coming into diseases, because we have Daktari on set. Someone is asking, okay, fine, guys, so which ones are these oral diseases anyway? So oral diseases are a major global, you know, public health problem affecting over 3 to 5 billion people, guys. However, dentistry has so far been unable to tackle this problem. I'm sorry to put you on the spot.
Yes, dentistry is not tackling the problem, yes.
And fundamentally, you know, different approaches now needed. In high-income countries, for example, the current treatment dominated increasingly high technology, interventionist and specialized approach is not tackling the underlying causes of disease and is not addressing inequalities.
Yes.
In oral health. Now, the global drive, as I come back to you, for universal health coverage provides an ideal opportunity for this integration. However, let me come back to you when it comes to the diseases we're talking about. One thing I would say from a layman perspective is I have been told, do not intimately, let me use the word, pardon me parents, I know it's family TV, kiss somebody if you have a wound, because that's already a dental problem, oral health issue. So there are certain diseases that get into our bodies through our oral system. And that's something that should come up, because that is the importance, the underlying issues, the underlying things or diseases that are chronic, but this is the entry point, the oral health. So give us some lineup on, you know, these oral diseases, the common ones, and what ought to be done.
Okay, so I'll take you a little bit, I'll divert from there a little bit. So I'll say oral diseases are linked with chronic diseases. So for example, we have diabetes. Diabetes is a major problem, right? When you have gum disease, it makes it difficult for you to be able to control your blood sugar levels. So there's a bidirectional relationship between your gum disease and diabetes. Unfortunately, many people who are diabetic do not know this, and they end up having trouble in controlling the blood sugar levels. And research has shown that if you are able to at least control the gum disease, you're able to have better control over your diabetes. So we really need to, as dentists, we really need to, as doctors, advise our patients that when you have diabetes, ensure that you visit your dentist and make sure that you have a healthy gum. Similarly, if you have gum disease and you're pregnant, there are high chances of you having a child with low birth weight. So the mouth, like you rightly said, affects your general health. And these are just some of the ways that we really need to start telling people about. We need to start talking about it and ensuring that people are aware that, okay, a dental problem is not just going to end here. It affects my general body. Yeah.
I was actually waiting for more. I was waiting for, I don't know how many people were waiting for more. And the relationship between my mouth and my body's health, you mentioned two. Could there be more?
There could be more.
Because there's diabetes, and I don't know how many people in this country, quite a number, are dealing with diabetes. If only they knew that there is more to just taking the, checking your sugar levels, and there is something with the gums.
Yes. So gum disease is linked with poor control of your blood sugars. Yes.
How common are gum diseases? What age group is at risk?
So gum diseases are very common. The first, the Kenya National Oral Health Survey that we did in 2015 says 98% of Kenyans have a gum problem.
98%?
Yes, yeah.
I'm sorry, guys.
So it's very common, and when the survey was done in children, they found like gum inflammation in most of the children. So yes, it's a very common problem, and we need to make sure that we visit the dentist to,
I know we are doing a lot of advocacy in this conversation, but for the sake of the Mwana Inchi, I would want to guard my gums, and I need that check. I'm going to be very honest. I haven't done it. And I want to know what causes this. What are the causes of these gum diseases?
So we have bacteria in our mouth, right? And we're constantly eating, we're constantly chewing. So we brush our teeth probably twice a day. Most of us, I hope, are brushing twice a day. So when you have the bacteria in the mouth, I'm just going to say it in layman's terms.
Yes, sure.
We have the bacteria eating up the surrounding structures around the teeth, right? Our teeth are supported by gums, bones, and that's what keeps our teeth stable in the mouth, right? When the bacteria are given food to eat, they cause destruction, and so the gums get eaten away, the bone gets eaten away, and over time, the teeth start to get loose. And that's what causes tooth loss. So when you have an inflammation in the gums, that's when you have bleeding. And I think some of us may have experienced bleeding while brushing. So that's caused by an inflammation in the gums. Yeah.
And of course, let me read some of the comments. A lot of questions coming in as well. I can see here, it's a very difficult name for me to pronounce, but War Alego, oh yeah, that's easy. War Alego, saying Salamu Anki, stringent measures must be imposed and should be imposed. I think that was from COVID-19. Moving on, Pastor Fred Asawe saying good morning, tuned in from Kiambu town. So people in Kiambu are following closely. What are the situations in Kiambu County? Now we go deeper into Kiambu County because other counties need to borrow. You mentioned you're the first county dentist in the country. Of course, congratulations to that. And the second we're seeing in Nakuru. So we're looking at other counties picking up this as well at their level. But what have you done in Kiambu County that different counties can borrow from as far as oral health is concerned?
So for Kiambu County, we had a strategic plan that was written in 2019 that was meant to increase the number of dental clinics. From at that time, we had 12. We had planned to increase it to about 18. We haven't managed to make it 18, but we at least increased it to 15. So that's one thing that we did in terms of the curative. So we also had a renovation of 2 dental clinics fully equipped at Riru Level 4 and Lari as well. So yeah, we had improvements in the service delivery, and that was one thing that we did. We also did training of community health volunteers, which was the first that was done in the country, because community health volunteers form the first point of contact with the public. And we realized that the community health volunteers were not being trained on oral health, but they were being trained on a lot of other things. So last year, in a partnership with Kenya Dental Association and a lot of partners, we held a training, and we wanted funding to expand that to the whole county. Unfortunately, that's still in the works. So yeah, those are some of the things we've done in Kiambu County. I wouldn't say it's been easy. Like I said, oral health gets sidelined, and even when COVID hit, everything else got sidelined. So for the past 2 years, we were just focusing on COVID, and now I think we're finally coming back to track. Yeah.
And we can't wait for you guys to get fully on track, and especially on matters mainstreaming. I'm looking at what schools are doing, institutions of learning, as far as oral health is concerned. I remember being a young girl, I studied science. All right, and then it was called science. I'm not sure I'm too old, but we could see a bit of, you know, oral health, talk about your teeth, incisors, canines, brush your teeth once, twice a day.
Yes.
I'm looking at, you know, as much as you say the clinics, there's 2 in your counties which you had to push for. How many public dental clinics could you count?
No, public dental clinics, so we have 1 in every sub-county in our county, so that's about 12. So we have around 14 now. Yeah, 14 public dental clinics. Yeah.
In the country or in Kiambu
County? In the county. Public,
And how many Kenyans against this number of public? You know, I am
2
going
million.
somewhere.
Yes,
I am going
2
somewhere
million. The
with
population of Kiambu County is 2 million. So yes, it's obviously not enough.
So there is a problem.
There is a problem, and I mean, Kiambu County is one of the better counties when it comes to health. There are counties that don't even have a dentist, and I'm just wondering what we're going to do, because if you don't have a dentist and you're all the way in, I would say, the north of Kenya, I've had cases where people have to fly down to get dental treatment done. So what about the person who cannot fly down?
Can I bring us to the normal situations? If I have one tooth hurting, I might not come to work.
Yes.
Because the amount of headache, the swelling, the pain, that's how serious oral health is. And just to bring everyone back to this discussion, this is the Healthy Inside Out. And the comment section is open for your input. Talk to us. We are live on Facebook. Use the hashtag #TheMorningDrift. What are your thoughts this very minute? I'd love to know. Talk to me. Remember, the doctor is also here. If you have any personal question, all right, we're talking about dentistry being quite expensive. Use this time to ask just one question before we wrap up in the shortest time possible. Is there hope?
Yes, definitely there's hope. I mean, the first things first, we've launched a strategic plan, which is the first in the country. Our PS Health also promised, and you know, she pledged, I think, 4 billion towards the oral health strategic plan. So that's also hope. We're getting more vocal. As dentists, we're getting more vocal about the problem, so that's also leading to a positive change. We're here, we're discussing it, so yes, there's hope. We all need to play our part as citizens, as doctors, as stakeholders, to make sure that the oral health strategic plan in Kenya is achieved as planned in the next 4 or 5 years.
And I like when you say now responsibilities are coming in, and Kenyans are asking, what do you want us to do with that information? I'll tell you shortly when we say we are all stakeholders, and what you, who is watching back at home, ought to do to make this campaign a reality from where you're sitting now. A bit more information. The dental care systems should focus more on promoting and maintaining oral health and achieving greater oral health equity. Remember, these are not my words. But of course, as you mentioned earlier on, our expert on set, sugar, alcohol and tobacco consumption and their underlying social and commercial determinants are common risk factors shared with a range of other non-communicable diseases, that is NCDs. Coherent and comprehensive regulation and legislation are needed to tackle these shared risk factors. Remember, on legislation, the 12th Parliament is sitting for the last time today. I'm wondering how many times I heard matters oral health factored in these debates.
I would say none. Yes, but we really need to focus on, like I said, legislation for tobacco consumption, alcohol consumption, and sugar. Yes, as a country, we really need to focus on that.
Does this mean that some companies are going down?
Unfortunately, the sugar industry is actually very influential, and they actually also play a big role in the research that we conduct as even oral health practitioners. So it's a very difficult thing to say. Tobacco industry has been around for years. There's no way they're going to go down, but we need to be able to find a fine balance between, okay, fine, taxing the products, increasing the sin tax on tobacco products, and at the same time ensuring that there's no big political, disturbance.
Okay.
What has happened in the past is when we, for example, attack the tobacco companies, they go ahead and say unemployment is going to be an issue then. So what happens then? You can't, of course you cannot shut them down. They're big, in the in the field.
All right, now that was just us walking into
Yeah.
stakeholders and responsibilities. And as we were talking, I hope it's awakening to you. If the tobacco industry will not shut down, will you regulate how much you smoke?
Yes,
All right?
we should.
We're going to come to that. And of course, just to bring it closer, at present, the sugar industry is influencing, like you said, the dental research, oral health policy, and professional organization through its well-developed corporate strategies.
Exactly.
Now, of course, that is something that we have touched on. And now someone is asking, fine, Anki, we cannot run away from our lifestyle, and the lifestyle, you know, topic is coming in. But of course, I can see Celine Nyangere saying, ask her how often one should visit a dentist.
Okay, so it's been long said that you should visit the dentist at least once a year, but research is saying that it depends on the person. Some people may need a visit more than once a year. So I'd recommend you to at least go to see your dentist first. I mean, have you even been to the dentist? And then let the dentist advise you on how often you need to come in. Yeah.
All right, so first you need to visit the
Take
dentist.
the first step, yes, take the first step.
And they will assess you.
Yes.
And then they can say, well, you ought to come here a little more often than you think.
Yes, yeah.
So, Celine, I hope you get your answer right here on Health Inside Out, asking how often should one see or visit a dentist. And Dr. here says at least once a year.
Yeah.
So annually would be good.
Yes.
But then the dentist will get to determine if you will come in monthly, weekly, etc.
It depends. Well, some people require, for example, cleaning more often. Yeah. So
When we talk of cleaning, really, let's discuss this cleaning aspect. What are we cleaning that I cannot clean with my toothbrush and my toothpaste?
Okay, so unfortunately, majority of Kenyans don't floss. Do you floss? Yeah. So what are we cleaning is we are cleaning the gums. When you brush your teeth, you're not able to reach in between the in between the teeth and under the gums. So we use special tools to clean under the gums and in between the gums. Yeah. And we are also able to get rid of stains, and a lot of calculus is formed. So let me just go back. So we have plaque in our mouth, in our mouth that forms after. Like it's generally after you brush, you can get some sort of soft plaque, which over time hardens because of all the salts in our mouth. So when it hardens, it forms calculus, which is some yellowish substance. It's, layman, we call it tartar as well, and that cannot be removed by a toothbrush. So we really need to have special tools to actually remove that tartar, because it actually causes gum problems and increases the chances of you losing your teeth. Yeah.
Okay. You know what? You just woke me up a little bit. I'm a bit woke. There's a certain age where your teeth start to fall off.
Are you talking about the first set of teeth or the...
No. The first set is okay. That's milk teeth.
Fine, yeah.
But once I get to age, I don't know what age this is. Is it practically what should happen, or is it just that we never used to clean our teeth and we didn't have to take care of our gums? So there's an assumption that, okay, it's old age, so they're falling off. Or I could still have my teeth intact. At what age should this be normal, and at what age do you really have a problem if your teeth are falling off?
It's not normal. You should be able to keep your teeth for life.
For life?
Yes.
Should I end the show?
If you take good care of your gums, you should be able to keep your teeth for life, yes.
So have we been lied to?
Yes.
Here's an ending that it's because of old age that you're losing your teeth. It's just that we haven't
been taking care of them, yes.
Tell us more on this, because somebody wants to save their teeth before they're 45.
45? That's very young.
How many youth or young adults lack their, how do you call them? The molars.
That's mostly because of dental caries. What happens is, unfortunately, poor diet, lack of brushing, not visiting the dentist on time, you're not able to recognize that you have a cavity on time. So by the time you get to the dentist, it's a little late, and you're offered a treatment called a root canal treatment, which sometimes, that was my experience, people don't want to go for it because, first of all, it's expensive, it requires a lot of visits, and they fear of the unknown. So they end up removing the teeth. And that's why we have the youth with a lot of missing teeth.
Yes.
And that is very preventable. I mean, you should be able to control your diet, make sure you brush twice a day, visit the dentist so that they can detect the problem early enough so that you don't end up having a very big cavity in your teeth. Yeah.
As much as it might look something minor, I'm asking it for the sake of any other person who has no idea about proper oral hygiene, the basics to this, or
it's
on the other
very
side,
much a problem. A lot of people don't know.
Yeah, we assume so much. I'm gonna chew gum here at work, pretty much stay to whatever time, probably sleep that way. I'm just giving an example. Is this poor oral hygiene, and what really should we be doing? Things that we pretty much treat like by the way.
So we should be brushing at least twice a day.
You really emphasize
yes,
that.
and especially before we go to sleep, that should be the last activity that we do, because when you sleep, you're not active, you're not talking, so the salivary action is also reduced. So if you go to sleep with food in your mouth, you can imagine what's going to be happening in the teeth. Right? There's going to be a lot of activity there's going to be a lot of food for the bacteria to act, and there's going to be a low pH. The acids are going to be able to be formed, and they'll eat away your tooth, and you'll end up with cavities. So you need to be able to brush your teeth and have a clean mouth before you go to sleep. You need to add in flossing. So flossing is you use a thread, like a thread that is obviously specially manufactured to clean in between your teeth, because a toothbrush, it's not just, it's like it's waxed, and I don't know the composition, but it's sort of waxed, and it's easier to use. You just don't go using thread. It's used in between the teeth so that you can clean in between the teeth and remove the plaque from there. If you don't, that's why most people end up with cavities in between their teeth, and that's very difficult to detect early, and it's also difficult to treat, because you have to visit a dentist and get a filling done.
True. And you have just created how important it is for the government to take this seriously. Usually I insist that President Uhuru Kenyatta, before he even leaves the government, is watching the morning drift.
I hope
because
so.
Here you get all the information you probably do not get. Like you said, we don't have proper data for oral health. But this is a challenge to the next ministry, if any. What are you doing in your counties as well? And Dr. I want to hear your closing remarks, especially on advocacy. At least you have clearly shown us why it's important, the things we overlook, what ought to be done. And I'm so glad with that positive energy where you said there is hope.
Yes.
But of course, as we close this, what would be your parting shot to this discussion? If any other question comes up in 1 second on social media, I'll pass it on to you. But for now, what would you say in summary?
In summary, I would say let's recognize this as a problem that we need to solve. We need to put our heads together to solve. Let's work, like you said, what do I want the ministry to do? Let's work on sorting out the water issue so that we don't have fluorosis. 41% of our children having fluorosis is very sad state. So that's my parting shot. Let's all work together. Let's push our ministries. Let's push government and hold them accountable so that we have better health. We have better oral health.
And of course, I still want you to keep talking to all stakeholders, mothers, fathers. This is
of
just
course.
a moment for you to talk to them as much
Of course, if you have a child, please make sure you take them to the dentist. There's rumors that I have heard that your child doesn't need to brush until they're the age of 3. That's totally untrue. Any tooth that is present in the mouth needs to be clean, so you need to start brushing the teeth as soon as 6 months, even if that's when the teeth, when you see the teeth, you should be able to start cleaning them. So yes, as parents, take care of your children's teeth, take care of your own teeth, hold the people around you accountable to provide you with the health care, and that's what I would say.
Hold your people accountable. I'm yet to find out, and Kenyans have begun to do that a lot, holding people accountable, because there could be finances, but as little as they are, do they help? All right, in actually pushing this. And I just got a bit of something to read from the one of the research that I found quite fascinating. And this research here, give me some little bit of time, and they say the practice of dentistry needs radical reform. That's what you're doing worldwide to better serve more people and less affluent communities. That is according to a 2-part series of reports that is in the Lancet, a leading international medical journal. Just to show you guys how serious it is that we had this conversation. And in their writings, the researchers from 10 countries say that profession continues to be more focused on treatment than prevention and has become increasingly inaccessible for lower income populations, like you said. And the 2 pieces are entitled, of course, if you want to grab some of this and read more, there is the Oral Diseases, a Global Public Health Challenge, and the other one, Ending the Neglect of Global Oral Health: Time for Radical Action. Of course, the authors led by Richard Watt, a dentist and chair of dental public health at University of College London. Now, I will not read the entire research, but this is just to show.
I would like to comment on that.
Yeah, please do.
So we as dentists as stakeholders are also the problem. And I wouldn't say it's intentional, but it's just the way our training is done. We are trained to treat disease.
Okay,
we
not
spend
to prevent.
we spend 5 years drilling plastic teeth, filling plastic teeth, and when we get out, that's what we know. And so when we go into work, we treat the disease. We don't focus on prevention. And even if we do, we probably give our patients just a one-on-one conversation on how to prevent the disease. So our training is more curative, more like drill and fill. Dentists are drill and we drill and we fill. So we need to change that, and we as dentists also need to take a more we need to use any platform available to us to become the advocates, instead of saying, oh, dentistry, the oral health is a problem, and sit in our dental clinics.
And one last question, I'm sorry, just answer it in just 1 minute. This is Preki Ngendo saying, can she speak about tooth sensitivity? This is one of those questions that pop when you're closing the show.
No problem. There's a lot of causes of tooth sensitivity, and I would say please visit your dentist, but it could be caused because of caries, a small cavity in your teeth. We could also have that the outermost layer of the tooth, that's the enamel, is being worn away, so the inner layers are more exposed, so you have sensitivity. So there are ways of treating it. I would say please go to the dentist so that you can actually know what the exact problem is before you just decide to do it at home.
Is it gargle salty water?
Or you could use desensitizing toothpaste, but you don't know what the issue is. Right?
So the good thing is, hey, we are advocating for more dentists, so you have someone to go to, but you also need to get up and seek this medical attention. Oral health, as you have put it, Daktari, is very important. Thank you for creating time to be here. Once again, you can reach her. Her social media platforms are, available. Reach out at Doris Anki Doris Ombat on Facebook, and at whatever point in time, Healthy Inside Out will continue to ensure that your health is your greatest wealth. Daktari, would you come back again?
Definitely.
We can't wait for the next session. All right, I take a short breather. We come back with an entire summary of what you might have missed this morning as we wrap up the morning drift. But still, we'll be right back. Don't go too far away.
Thank you.
Hey, how's that?
Are you looking to turn your passion to purpose? Vera Beauty and Fashion College now brings you online classes at the comfort of your home. We are a TVET-approved institution with over 20 years experience in training competency-based courses in fashion design and creative arts, cosmetology, hairdressing, beauty therapy, interior design in soft furnishings, event decoration and flower arrangement,